So the network really was born, as Ashok mentioned right at the beginning, from the Altogether Better Health Conference in 2016 that was hosted in Oxford. And the conference was really hosted by CAPE, which is the Centre for the Advancement of Interprofessional Education, which is a UK-based charity think tank full of professionals and academics who have worked interprofessionally for many years and are building the cause and making a case for the widespread dissemination of interprofessional practice. And that's really when I came across an amazing, quite career-changing workshop led by Bill and Ashok around values-based practice. And I thoroughly enjoyed it. I had, as usual, an awful lot to say, far too much to say. And Ashok and Bill approached me to find out a little bit more about it. So from that very early work in that conference, it became very clear that there was, or it became clear to some of the evangelists of it, that interprofessional education and values-based practice could be interlinked and were relevant to one another. So the network was really born from that, with Richard Gray taking it forward. And the first inaugural meeting really was in 2017 on the back of that international conference. 35 different countries represented at the conference, with a really broad interest in interprofessional education and values-based practice. So an inaugural workshop developed the network, and the following year we all came together at St Catherine's to really explore it. And one of the really interesting parts of this, and I think why I find it so fascinating, is that there is a little bit of an uphill battle with this, in that there is an understanding or a belief that values-based practice is implicit within interprofessionalism and interprofessional practice. And what I believe, and many of the other evangelists of this work believe, is that it needs to become explicit. And that is a very clear drive of the network, to take it much more into the consciousness and the understanding with practitioners. And our third one last year was around the Fourth Industrial Revolution, which sounds a little bit off-piste, but actually it was looking at augmented reality working, the way we have to work differently for a Fourth Industrial Revolution, and not lose sight of what values mean to patients, practitioners, and partners in care. Next slide, please. So the vision of the 5-year plan is very much to move forward. I'm not going to read it for you, you'll be able to do that, but we are very clear how important this work is. I work with practitioners and academics who talk about person-centred care or patient-centred care very glibly, and it falls off and rolls off the tongue. However, when it comes down to it, when it comes down to the cold face of working with people with real needs and real problems, the values part of it can be very much a secondary issue, even though they will be able to tell you Adam van Eyten exactly what they think person-centred care is. So our role will be to keep marching forward to promote our activities externally. Next slide, please. And this looks like a really bizarre slide, so let me tell you just a little bit why I've put it there. Interprofessionalism, for those who might not really have a really great grasp of it, is really about the collaborative practice of learning with, from, and about one another, and having the skills in order to do that, the skills for robust consultation, of robust open-minded thinking, of teaming as a verb in all situations, of learning to team in rehearsal, of building resilience and grit across multi-professional, across interprofessional teams, where not only the science is blatantly clear in what the decisions we make, but it is with the two-foot approach of values being as equitable as the science. So active listening, patient-person safety, intergeneration working, positive interdependency within large-scale teams that changed on a daily basis, and doing that as we do certainly at Robert Gordon University is about underpinning that on day one of courses across the health and social care gamut. So the network is about really bringing values-based practice to the fore in interprofessional education across the piece. Next slide, please. Why do we need to do that? So I've got the top of there, the Fourth Industrial Revolution. Actually, right at the top of there, it should say people. our human work, why we need to develop interprofessional and values-based practice in a way that is useful to people, that is real and is meaningful and matters to people, capturing human capital. So all of the work that I look at around fourth industrial revolution working for collaborative practice is all about the human being and capturing human thoughts and emotions as we build towards values-based practice. Moving away from professional tribalism, recognizing the values of oneself and of others and valuing them as much. Complex problem solving, a way of thinking, being wide open to listening actively to what others say and how we build in practice. Next slide, please. So I've only got a few minutes. I would love to talk about this longer. Unfortunately, Bill and Ashok can mute me, so I'll be very quick. But values-based practice in health and social care is evolving. It's becoming much more talked about. It's not the secondary aspect of decision making, but it has to be driven. And if I've learned anything from leading interprofessional education and now being much more closely involved with values-based practice, is that it has to be driven forward. It won't happen serendipitously. And many practitioners will think that they are already doing it, but actually when it comes down to decision making, are they actually doing it? Are they actually making decisions with, for and about, or are they doing it for themselves? So my goal in leading the network when I take over next week will be about making the implicit the explicit in interprofessional learning relating to values-based practice. Thank you.